Autonomic responses during bladder hydrodistension under general versus spinal anesthesia in patients with interstitial cystitis, bladder pain syndrome, a randomized clinical trial. What is the bladder and why does it hurt sometimes? The bladder is a part of your body that stores pee until you go to the bathroom. Sometimes, people have a problem with their bladder that makes it hurt when it fills up with pee. This problem is called interstitial cystitis or bladder pain syndrome, IC, BPS for short. People with IC, BPS may feel like they need to pee all the time, even at night, and they may have trouble holding their pee. They may also have pain in their lower belly or in their private parts. Doctors don't know exactly what causes IC, BPS, but they think it has something to do with the lining of the bladder. The lining is like a protective layer that keeps pee from irritating the bladder wall. In some people, this layer may be damaged or missing, so pee can get into the bladder wall and cause inflammation and pain. The inflammation may also affect the nerves that send signals from the bladder to the brain. These nerves may become too sensitive and make the brain think that the bladder is full or hurting even when it's not. How do doctors check and treat IC, BPS? One way that doctors can check if someone has IC, BPS is by doing a test called bladder hydrodistention. This test involves filling the bladder with water through a thin tube that goes through the urethra, the hole where pee comes out. The water stretches the bladder and makes it bigger. Then, the doctor uses a special camera called a cystoscope to look inside the bladder and see if there are any signs of IC, BPS, such as red spots, cracks, or ulcers on the bladder wall. The doctor can also take a small piece of tissue from the bladder wall for further examination. Bladder hydrodistention can also be a treatment for IC, BPS, because it may help reduce inflammation and pain in some people. However, this test can also cause some problems, such as bleeding, infection, or even tearing of the bladder wall. Also, some people may feel more pain after the test than before. Another problem with bladder hydrodistension is that it can make the blood pressure go up very high in some people. Blood pressure is the force of blood pushing against the walls of the blood vessels. When blood pressure is too high, it can damage the heart, brain, kidneys, and other organs. High blood pressure can also cause headaches, dizziness, chest pain, or difficulty breathing. One reason why bladder hydrodistension can raise blood pressure is because it stimulates the autonomic nervous system. This is a part of your nervous system that controls things that you don't have to think about, such as your heartbeat, breathing, digestion, and sweating. The autonomic nervous system has two branches, the sympathetic branch and the parasympathetic branch. The sympathetic branch prepares your body for action or danger by speeding up your heart rate, raising your blood pressure, and making you breathe faster. The parasympathetic branch calms your body down by slowing down your heart rate, lowering your blood pressure, and making you relax. In people with IC, BPS, their sympathetic branch may be too active and the parasympathetic branch may be too weak. This means that their body reacts too strongly to bladder hydrodistension and their blood pressure goes up too much. What did the researchers do in this study? The researchers wanted to compare two different ways of doing bladder hydrodistension in people with IC, BPS, under general anesthesia or under spinal anesthesia. Anesthesia is a way of making someone feel no pain or sensation during a medical procedure. General anesthesia is when someone is given drugs that make them fall asleep and not feel anything. Spinal anesthesia is when someone is given an injection in their lower back that numbs their lower body but keeps them awake. The researchers thought that spinal anesthesia would be better than general anesthesia for preventing high blood pressure during bladder hydrodistension in people with IC, BPS. They thought this because spinal anesthesia blocks all nerve signals from below the injection site, including those from the bladder and those from the sympathetic branch of the autonomic nervous system. General anesthesia does not block these nerve signals completely, so some people may still have high blood pressure during bladder hydrodistension. The researchers did an experiment with 36 people who had IC, BPS and were going to have bladder hydrodistension. They randomly assigned these people to either have general anesthesia or spinal anesthesia during the procedure. They measured their blood pressure and heart rate before, during, and after bladder hydrodistension. They also used a device called an electrocardiogram to measure the electrical activity of their heart and see how their autonomic nervous system was working. They also asked them how much pain they felt after the procedure and looked at their bladder wall for any signs of IC, BPS. What did the researchers find out? The researchers found out that spinal anesthesia was better than general anesthesia for preventing high blood pressure during bladder hydrodistension in people with IC, BPS. They found that The people who had general anesthesia had a much bigger increase in their blood pressure during bladder hydrodistention than the people who had spinal anesthesia. The difference was about 70 millimeters of mercury, which is a lot. For example, normal blood pressure is around 120/80ths of a millimeter of mercury, and high blood pressure is above 140/90ths of a millimeter of mercury. The people who had general anesthesia also had a bigger increase in their heart rate during bladder hydrodistension than the people who had spinal anesthesia. The difference was about 15 beats per minute, which is quite a lot. For example, normal heart rate is around 60 to 100 beats per minute, and fast heart rate is above 100 beats per minute. The people who had general anesthesia had less activity of their parasympathetic branch of the autonomic nervous system after bladder hydrodistension than the people who had spinal anesthesia. This means that their body was less able to calm down and lower their blood pressure and heart rate after the procedure. The people who had general anesthesia felt more pain after the procedure than the people who had spinal anesthesia. They also needed more painkillers to feel better. The people who had spinal anesthesia had less bleeding from their bladder wall during the procedure than the people who had general anesthesia. This may be because spinal anesthesia makes the blood vessels in the lower body narrower and less leaky. What does this mean for people with IC, BPS? This study means that spinal anesthesia may be a better option than general anesthesia for people with IC, BPS who are going to have bladder hydrodistension. Spinal anesthesia may help them avoid high blood pressure, which can be dangerous for their health. It may also help them feel less pain and have less bleeding from their bladder wall. However, this study also has some limitations. For example, it only included 36 people, which is not a lot. It also did not follow up with these people for a long time to see how they were doing after the procedure. It also did not compare how effective bladder hydrodistension was for improving their symptoms of IC, BPS. Therefore, more research is needed to confirm these findings and to see if spinal anesthesia has any long-term benefits or risks for people with IC, BPS who have bladder hydrodistension.